Over the last year, I've spent a lot of time in a rural African-American North Carolina community. I've personally seen the health disparities that this community experiences, including teen pregnancy and deep-rooted trauma. Some of this comes from historic impacts from flooding, from hurricanes, from poverty, and also from embedded racism. I've been working with one group to develop a game. We were deep in the design process, and it was time for a break. When we took the break, most of the conversations were pretty much what you would expect on daily activities. But I attuned to one conversation specifically. Mary, one of the design team members, approached our program director from Michael's Angels Girls Club. She said she was excited to be there to be a part of the design team, but she really wanted to thank Michael's Angels Girls Club for being there for her and her family after they experienced devastating impacts from the floods. They provided her the stuff that she and her family needed to survive. We've seen declines in teen pregnancy prevention, and we have also seen a solid list of evidence-based programs being developed in this area. Luckily, we have also been provided the opportunity to mobilize new programs in teen pregnancy prevention. The Innovation Teen Pregnancy Prevention Program, also known as ITP3, is here at Texas A&M and is developed to facilitate the development of new programs and innovative programs to reach youth. In order to start this initiative, we asked ourselves two questions. One was, how do we define innovation? And two, how are we going to facilitate the development of new programs? So in order to embark on this initiative, we also developed a model of innovation that would support the work and identified capacity building needs. So we adopted systems thinking in order to broaden program approaches, and also design thinking to gain insight from the youth and allow them in on the process and make sure that we have user feedback and that we had youth-focused programs. Both of these together with the systems thinking and design thinking allows us to iterate the process and not arrive at the design stage with one answer in mind. So now let me go back to the community that I had been working with. We received an application as the ITP3 team to host an intensive boot camp there. This boot camp included 4 days of iterating ideas, and we had 4 community organizations and their teams arrive at the start of the boot camp. Michael's Angels Girls Club, which I mentioned at the beginning, their motto is to convert idleness to action. They pitched an idea to a community board to develop a game that connects youth to adults in their community. They were selected to move on to the next phase of our program, and they actually engaged in design sprints where they continued along the design phase and were able to prototype a game that would be used with youth. So youth engaged in pitches and actually engaged in gameplay during this process. Today, Michael's Angels Girls Club is feasibility testing using the game, a game that connects youth to the community, helps them tap in to find the resources to be able to access information, develop their communication skills, and help them with decision making. This approach overall has been one that allows us to engage with communities and enhance the skills and the iteration of different ideas without landing at one idea. What I really love about our project is that we work with organizations that bring youth to the table and that bring teams to the table that care about the communities that they are working with. Michael's Angels Girls Club has gone a long way from providing basic needs for Mary and people in her situation, to growing as an organization, nurturing youth relationships, and developing a teen pregnancy prevention program that's going to impact their community.